Wonderful. So she did great, Michelle. Your mom?
Yes.
Our pleasure, absolutely. Doing okay?
Good.
You feel all right?
I feel fine. I knew you were doing your work. I didn't want to bother you.
Look at that. It looks fantastic. Any pain at all?
None.
Exactly. Wonderful. So you had your very advanced cataract surgery yesterday in our surgical suite.
Yes.
Anything about the experience? Any pain? Any discomfort?
No pain at all. No pain whatsoever. It was perfect.
How was your experience there?
It was very good. Very
And
good.
Michelle brought you over. Michelle, thank you for bringing her all the way from the West Coast.
That's for you.
You don't have to do this, Sean.
You don't have to do what you do either. Take
Oh.
on these severe, complex cases like my mom and myself. Work your magic that you do, right? Treat us like family, but most importantly, give us the gift of sight. So I just want to say thank you.
Oh my God, such a big compliment. Phenomenal stuff. How can I thank you? You worked your magic on my mom's eye. Made me feel like family. She had a very complex case. Her vision is very important. We didn't. And you touching her eyes. Time you gave us, the care you provided, the countless hours studying, planning. Thousands of people, we are so grateful. Goat.
You are the goat.
Vision for difficult cases. An honor.
Thank you. We appreciate you.
Sure. How
so
are your
much.
eyes doing?
Are you kidding? 2020.
Absolutely. Again, guys, careful in your travel to the West Coast now. Drops, you know what to do, right?
Yes, 4.
Thank you again so much. Thank you. Feeling okay?
Doing fine.
Lovely, nice and relaxed. The lens is now being delivered in your eye, unfolding itself, and I'm placing it exactly on axis for your eye astigmatism, alright? Comfort again, you okay?
I'm good.
Good, super. Super. If a doctor's watching, I'm talking to the patient throughout. Patient has no anesthesia other than numbing drop, even in such a complex case. And I keep asking the patient, one, to make sure they are comfortable. And second, also sharing the experience with doctors that these things are possible even in very complex cases. Right, Judith?
Yes.
Anything you want to say to doctors who are constantly here, and I'm sharing also with other doctors elsewhere?
I'm absolutely amazed. I'm feeling nothing down here.
Very nice. Are you breathing okay?
Good.
And that's the other thing I keep checking, even though the surgery lasts 3.5, 4 minutes, it's important. A little pressure now as I go in and I remove the gel, alright?
Okay.
Lovely. Doctors, I'll be using my two-hand technique to place the toric positioning exactly where I want. My rexus is exactly the size I want for toric cases, and this is a high toric clarion lens implant in a patient with very dense cataract, pharsightedness, keratoconus, and fuchs dystrophy with high regular astigmatism. Here we are doing LaZrPlastique. Polish.
Polish.
Good, now I'm cleaning out the bag that you leave behind, right?
Okay.
Comfortable, right?
Yes.
Lovely. And doctor, again, my differential polishing technique. So you don't do the entire bag. This way your lens always stays secure. There is no rotational issues ever in these cases. So the two-hand technique, and how finicky I am about that. A nicely cleaned up capsule. You can see the marks are exactly matching of this high toric clarion lens matching those on the cornea. And the patient doing great here. You can see the corneal dystrophy, the scar, the fuchs, Keratoconus, dense cataract is out, and she has no anesthesia other than now PSS. Very nice. Dude, how's the comfort level? You're comfortable?
I am.
Wonderful. And here we are, coming out. Beautiful.
Okay.
How was your experience?
That was very good.
Beautiful. You did wonderful. Congratulations.
Feel absolutely wonderful. I'm amazed by the whole thing.
Any pain at all?
I have no pain. No.
And doctors, you're seeing again all day as we operate every day. Patients have no anesthesia other than running drops, and she actually had the anesthesia, and right, and nothing, no drugs. There is no IV. There is nothing going on.
Nothing.
And in these complex cases, now here's something unique about her case. The left eye we did, and she had taken the MKO tablets with monitoring with the anesthesia doctor, because we have all levels of anesthesia here, but nobody really takes it. And we did that just because of her extreme complexities and just wanted to give her the extra level. And today she opted for nothing. So I also want you to explain the difference do you feel? Left eye, remember when we did your left eye 2 weeks
Exactly.
ago, you had traveled all the way from the West Coast,
Correct.
and we had given you the MKO tablet under your
Yes.
tongue, and then we
Right.
had the anesthesia doctor just to monitor you. How do you feel today with nothing?
I am absolutely surprised in the difference in the way I feel.
Like what?
I think I was very groggy when I left here the last time.
Wow.
And today I'm very alert and able to have a conversation with you.
So this patient in particular I'm showing you, doctor, though every patient is alert, they walk up, they leave, they go home, is to show you that even the difference, how the patient themselves compare.
Yes.
This is important. I'll talk to you later about the medical aspects, but throughout the surgery, as you saw, even though the surgery takes minutes, is how we are chatting, talking, making sure she's okay, she's breathing, she's comfortable, all that kind of stuff, right?
Yeah.
Tell Michelle everything went well. Very proud of you.
Thank you so
Very
much.
Happy with the way I feel. I feel more alert than the last time. I think it's amazing that I can see you and everyone in the room.
Wonderful.
I just feel good.
Excellent. And doctors, the reason I keep showing you all these things is to show that these things are possible, even in such complex cases. And I always teach the only real accountability is the patient on camera. So even though her case was complex, she had no anesthesia, nothing besides numbing drops, ahizo. And her other eye, the reason I'm showing you this, actually she did take an MKO tablet with monitoring with the CRNA. So she's comparing, and which eye do you think you feel better with?
I think I feel better with this one. I have to tell you, I don't remember much of 2 weeks ago today.
And again, that's a great safe technique.
It
We
is.
just did that for you, just overboard, because we have so much options here. But doctor, these are regular patients or regular meeting every day here. Patients don't take anything despite their complexity. So safe travels back to the West Coast. Been an honor.
Thank you.
Give my regards to Michelle.
Oh,
I'll
I'll
call
do
her
it.
for you. I'll make sure. Feeling okay? There's everybody for you.
Bye.
Let's meet your husband outside. All right, here she is. Second eye done. How do you feel?
I feel wonderful.
Yes.
How do you feel?
I feel great.
Okay, well then we're good.
So no stretcher, no drugs, nothing.
Nothing.
And we to teach your case, we've been showing doctors because your left eye you had the MKO sedation.
Right.
This eye you had nothing, like all our patients.
Right.
How do you rate your experience when you're walking out, you're talking?
I think I'm more alert today
Yes.
and, just much better.
How was the experience?
I think the experience was good. I like that you kept checking in to see how I was,
Yes.
and it was all tolerable. So I don't.
And I was
see
in
no
your
problem.
eye and we were chatting.
You were in my eye, and we were chatting.
Both eyes done. Safe travels back. Come on. All your vitals look great.
Yes.
Ready to roll?
I am ready to go. You did a great job.
Come on, walk you outside. All right, let's go.
Let's go.
Did wonderful.
Yes.
Look at that, you're walking in a park holding my hand.
I know. Bumping in the
All a
front.
pleasure, all of you guys. All a pleasure. Look after her, safe back to the hotel, and then I'll see you guys tomorrow.
You will tomorrow morning.
Take care, and behave like a patient. Don't just keep running. Hold her hand, please, ma'am. Hold her hand. Please make sure you
Ready to go?
recline in the car. Yes.
I'm waving at Liz.
Again, recline in the car, please.
Yeah, we're already.
Rest in the hotel. I'll see you guys tomorrow. Yeah, please hold her hand. Don't run, Judith. Looks great. Fantastic incision already healing. Great reaction. On axis, height toric lens. Previous side doing very well. So we'll be continuing the teaching pattern on all our patients. Yesterday, as we did your surgery, without any anesthesia besides numbing drops. Any pain
No pain whatsoever.
during surgery, immediate post-op, last night while sleeping, today?
Nothing. No pain at all.
Wonderful. So doctor, that's very important to talk and teach. And as I said, as most of our patients don't take anything besides numbing drops, and these are intraocular cataract surgery, LaZrPlastique based, right?
Right.
But she had taken for her left eye, what we call MKO, okay? And that's a sublingual,
Correct.
with the anesthesia doctor monitoring her. So again, can you tell us the difference?
There's a huge difference.
Like what?
The difference is I don't feel sluggish or groggy at all.
Wow.
I can walk to the restroom by myself. With the last one, I needed assistance.
Wow. And with both you had pain, no pain, any?
Neither did I have pain with.
Wonderful.
I had no pain either time.
Wonderful.
But there is a difference in the recovery, I personally believe.
Wow.
I think that I feel 100% is what I'm going to say today. I can walk on my own. I can talk to you. I had an amazing experience here. I had LaZrPlastique.
LaZrPlastique. Oh.
LaZrPlastique.
Yes.
I knew I was trying to say it.
Yes.
And it's absolutely amazing. It's amazing, and I was in the spa area yesterday, which was over the top amazing, and everyone there is wonderful. Everyone knows their job, and my experience was wonderful, and I wasn't a simple case. I know that. I know it was complicated.
Yes, you had traveled a long distance to be
Traveled
here.
a long
This is
way.
your second eye.
Yes,
So, and I already spoke to Michelle yesterday. I told her you're doing great.
and she's
So,
thrilled.
Yes, she's thrilled. She's another amazing patient we did. So, doctor, very important. So today we're just completing for you all the pain cycle of these patients that they really have none, even with such complex cataracts, just with numbing drops and a Huso, how well they do, and how they can even compare to an eye where they had, again, sublingual. No sedatives, no IVs, no pinpricks, nothing like that. And even compared to that, they appreciate this experience where they're walking out, no stretcher.
No stretcher, nothing.
Important to relay all this,
Yes.
and how they feel and how they see also. Very accurate landing despite their complexity.
Absolutely.
Safe travels back. You promise to be
I
careful.
promise to be so
Yes,
careful.
call me when you get home.
Thank you. I
Okay.
will.
Wonderful.
Hello, my name is Judith Henderson, and I came to Dr. Gulani about a year ago with my daughter, Michelle, who had had RK surgery back in the late 80s, early 90s, and had started actually to lose some vision. And I had been to many doctors with her, 5 to be exact, who all turned her away saying they could do nothing. So we did some research and we came across Dr. Gulani, who is in Jacksonville, Florida. So we made an appointment and we came here. To say that we knew we had found the person who was going to help her repair her vision, it's an understatement. He was the one, and we knew it from day one. She had both of her eyes done, and I stayed with her. We were here almost a week both times, and she did wonderfully well, and her sight is now back to 20/20 in both eyes, which leads me now to my eyes. I had cataracts in both eyes, complicated by Fuchs disease and a few other complications, and the cataracts probably should have come off many, many years ago. So my daughter insisted that I come to Dr. Gulani as well, so I did. So here's the amazing part. Today is day 1 on my right eye, and I can see. It was an amazing experience, both of them were. But my first eye, because of my age and because I had some heart difficulty, I took something called NKO, which just is a small pill under my tongue. No needles, no other anesthesia other than numbing drops, and my experience was wonderful. But compared to what I had yesterday to today, it's phenomenal, because I'm walking on my own and I'm seeing out of my both eyes, and I have absolutely no side effects at all. No pain from either eye. But the big story here is that I can see. So if you have had any situation with your eye, I would tell you undoubtedly you need to contact Dr. Gulani, because he's great, and his office staff and his surgical staff, phenomenal. I was yesterday in a place that's their spa, and it's exactly like a spa. You would never believe that you're in a doctor facility. So I hope you hear this and believe it, and do yourself a favor and call Dr. Gulani.